Everyone knows what it's like to love someone. A parent, a spouse, a sibling, a grandparent. And one of the most difficult things to do is to say goodbye too soon. This is my story. I'm Dr. Dex Galban, CEO and founder of Alaga Health. And this is my grandmother. When I was much younger, my family lost my grandmother because we were unable to easily find affordable quality home health care, not knowing that after she passed, just a few blocks away, there were nurses actively looking for work before they departed the country. And she's not alone. 60% of Filipinos die without ever seeing a health professional, while 80% have never even had a full medical checkup. I personally saw this when I was training as a young doctor in one of the public hospitals in the Philippines, wherein it would take up to 10 hours for just 10 minutes worth of medical consultation. They would wait up to 10 hours to receive just 10 minutes worth of medical consultation. That meant missing a day of work, spending money on food, and losing the opportunity to take care of their families. And this is the reason why we experience all of these challenges within the Philippine healthcare system. Lack of access to affordable quality healthcare. Maldistribution of gainfully employed health professionals, and low investment in health technologies. That's why in the Philippines, you could see that in some hospitals, patients would line up as early as 4 in the morning just for the chance to be seen by a health professional. All hoping that after traveling miles from different provinces to the metro, that they would have that sliver of an opportunity to be seen by a health professional. And because of all of these challenges that we've seen, that I have gone through as both a nurse, a doctor, and someone who is a part of a family that experienced health challenges, I wanted to provide a solution. And this is how Alaga Health was born. This is how a digital health social enterprise was born. This is Alaga Health, the Philippines' first universal digital health marketplace and health service aggregator that hopes to address all of these issues that we have seen, to provide quality and affordable healthcare to those who need them, and to provide an opportunity for health professionals to get additional revenue and hopefully be given an incentive to stay in the country. Because through our integrated web systems, fully customizable admin panels, and handy mobile applications, we're able to provide access to healthcare anytime, anywhere, in every way. And this is why we exist. At its core, our purpose is clear. So, to anyone who is hoping to start an organization, a social enterprise, a business, the first question that you need to answer is why. Why do you want to begin? Why do you want to create? Why do you want to build? Because creating an organization, starting a business, establishing a social enterprise is very difficult. But when you know why, when you know your purpose, everything will fall into place. And while that might be daunting to quite a lot, here's the good news. You are not alone. Because apart from finding your purpose, you need to find your people. And those are actually two groups. Your team, and of course, the people who you hope to serve. Now let's begin with your team. When establishing a business, when establishing an enterprise, you need to be able to understand this fundamental truth that you cannot do it alone. That you will need the help of every single individual who hopes to achieve the same purpose as you, who hopes to achieve the same outcome as the organization. For Alaga Health, that meant seeking help, building a team, building a diverse group composed of health professionals, government officials, international designers, software developers, experts in marketing and sales, in order for us to establish an organization that would hopefully fill in the gaps within the healthcare system. And apart from that, you would need to understand the second group, the people who you actually want to serve, the people who would be your partners, your allies in establishing an enterprise that will answer that problem, that will provide that solution. And for us in Alaga Health, that meant working with both local and international patient organizations, working with micro, small, and medium-sized enterprises, working with NGOs and nonprofits in order for us to better understand what we can do to address the gaps in healthcare. What can we do to ensure that the waiting lines are reduced? What can we do to ensure that any time that you need help when it comes to healthcare, you can access them at the click of a button? And through working with these organizations, with these institutes, with these nonprofits, more so the patient organizations, we were able to understand their pain points. We were able to understand what help they needed and design a system, design a solution tailored to their need, tailored to the gaps that were not being addressed by the current systems in healthcare. We created something for a purpose. And that leads us to the next challenge for young entrepreneurs, the next hurdle that they need to address, the hurdle of actually running things, moving forward, growing, then scaling. Because at the end of the day, as I've mentioned, you do not have 100% of the answers 100% of the time. And therefore, it would be great for you to take a step back and understand what else do you need to learn. Is it something about legal? Is it something about marketing, sales, operations, or general administration? What learning needs do you and your team have? And this is where all of the other partners and institutions would come in. Your international development organizations, your non-profit entities, those that are driven by the community can provide you with the assistance, the insight, the learning capacity in order for you to more effectively move forward. Considering working with these institutions, accelerators, incubators, all of whom are hoping that your social enterprise, your startup, your organization would succeed. Why? Because if you succeed in resolving a problem that has been felt by so many people, then we have made the world a little bit better. And with that being said, one of the things that I hope to leave you with is this reminder. The youth are done waiting for the world to change. And the world is now waiting for the youth to change it. In the Philippines, that means that the Filipino youth are done waiting for our country and the world to change. And that our country and the world are now waiting for the Filipino youth to change it. For us in Alaga Health, we invite you to work with us. Support social enterprises, startups, and all of those hoping to address issues in our society. When it comes to healthcare, we believe it's always better when we're doing it together. So, let's start changing the world today and make this world a healthier and more sustainable place to be in. I'm Dr. Dex Galban from Alaga Health. Thank you very much.